Welcome to today's show. My name is Jeff Whiting with Senior Transition Services. We are a senior referral agency that helps families find placement for assisted living, memory care, and independent living, and it's free, no cost to you. Today's guest is Angela DeLaere. She's the president, CEO of Visiting Nurse Association and Blue Water Hospice. Thanks for being on the program today, Angela.
Absolutely, Jeff. Thanks for having me.
Well, why don't you tell our viewers today just a little brief overview. What does your agency provide at Blue Water Hospice and Visiting Nurse Association?
So, DNA and Blue Water Hospice has been in the area since 1952. We are the original visiting nurse association here in town, offering home care services, private duty services, and hospice services throughout our community. We cover St. Clair County and we cover the surrounding counties, so southern Sanilac, eastern Lapeer, and northern Macomb counties.
Angela, what are some of the specific services that Visiting Nurse Association and Blue Water Hospice offers?
So the primary focus of Visiting Nurse Association and Blue Water Hospice, we have the three divisions. We have home care, focusing on the skilled need of the patient. We have private duty services, focusing on keeping those independent in their own home. And then hospice services that we provide patients at the end of their life.
Angela, with VNA being a nonprofit, what does that mean to the people that are out there? I think that's an important thing that needs to be explained to individuals.
So I personally and the agency prides ourselves on being nonprofit because we are not worried about the bottom line. We're worried about the patient. We want to make sure the patient's needs are taken care of. Any dollars that we receive, they go back to the patients for charity care, for keeping them in the home, and then assisting in the hospice home down in Marysville. So it's very important for everyone to realize that our nonprofit is the community dollars at work.
What about the financial aspect for these patients and the resources that you have available for the types of services that you have? Why don't you let us know how that may work?
I'm glad you asked, because we cannot do what we do without the support and the community partners we have. So there's grant funding available in our community. We have a very giving community. So grant funds are provided to our agency to care for those who do not have another financial means to do so. We have a handful of community partners, one being Commission on Aging, and they provide grant services to our private duty division, our home care division, and then lastly, they provide grants for our hospice home room and board. So those who cannot stay in their home to receive their end-of-life care, they come to our home in Marysville. Our hospice home is located in Marysville, and there's dollars to help them stay there. And that provides a very safe atmosphere and a safe environment for them to live out the last days of their journey.
Okay, great. What about people that may be watching, Angela, that may not be in our local area right now? Are there organizations like Visiting Nurse Association throughout Michigan, that's not in your region where you service, or is this just unique to the local area that we are operating in?
So in our area, there is other home cares, there are other hospice, and there are private duty services. But what we provide our community is that personal touch. We're a small agency, we're nonprofit. We have the support of the United Way, we have the support of the Commission on Aging, and the support of AAA1B. So we have such a long longevity. We've been in the community for an extremely long time. And we're that safety net, we're that net for the community. So anyone around that does not have financial, is not able to pay for their own care, we're able to help them with that.
What I'm hearing, Angela, is that your team is having these conversations with patients and their families, and I see a real opportunity for our two agencies to come alongside one another. Senior Transition Services is that senior referral agency that is helping families with finding placement for assisted living, the memory care units, and independent living. And is your team, when they're having these conversations, they're recognizing what I'm hearing, those kind of signals that a loved one may need to take that next step and be placed in one of those types of communities. Is that what you're seeing with your team?
Absolutely. So with our agency and our longevity and being able to provide it financial support to them, I think that there's another avenue that we can partner in. There's another way to partner with you, because with our social workers and our nurses and our therapists out in the field, our nurses, our health aides, they're seeing things in the home that obviously we're not seeing in the office, and they're able to reach out to you and build that partnership and help those that can no longer stay in the home and they're not at the point where they need to go to the hospice home. They're able to reach out to you, and you can help them into an assisted living or a nursing facility.
Okay, and you mentioned, that continuum care. You're coordinating probably with other skilled professionals within the area. So, as visiting nurse association, are you working with physicians as well? I mean, is there a team collaboration there, or?
Absolutely. So when it comes to the physicians, there's an order, especially with the home care division. There's an order that's needed for our skilled need. We're working with the physicians' offices, with all the professionals in their office, including their care coordinators, their nurses, the physicians, the nurse practitioners, physician assistants, whomever it may be, the point of contact for that patient and that family. We work with them to make sure that patient is taken care of and safe. So if they're no longer safe in their home, we would definitely reach out and try to get them placed.
In today's healthcare, with the rehospitalizations that takes place, I'm sure that your organization and your team is vital in making sure that a patient that's been discharged from the hospital is not being readmitted to that hospital.
Absolutely. We are the eyes of that whole team in the home. So our social workers, our therapists, anyone on our team that walks into that home is able to identify the need or help the team realize what the needs are for that patient.
Are the residents in the area able to contact you directly, Angela, at BNA, or do they need an order from a physician's office?
We have a brand new website we just launched, and so you can find a lot of information out on that. And that's www.bnabwh.org is one spot, and then also obviously a phone call away. Our phones are answered 24 hours a day, and we would get them to the right place.
Angela, thank you for being with us today. If you're feeling overwhelmed with the process of finding a place for your loved one, please give us a call at Senior Transition Services. We are a free, no-cost, specialized agency that helps you during this process. We will do the work for you. We will find the right place with the right care and within your budget. So give us a call at 810-300-7809. That's 810-300-7809, or visit us at our website, www.seniortransitionservices.net. And we look forward to speaking with you.